Tēnā koutou, tēnā koutou, tēnā koutou katoa. Mā tēnā, mā mano, kia rapa, tia whai. By many, by thousands, the work will be accomplished. Unity is strength. Ko taranaki te moana, ko whakaraupo te moana, ko hekatere te awa, ko pakiha te iwi, ko Jane Goodwin taku ingoa. Kia ora everybody, I'm Jane Goodwin, and I'd like to welcome you to the session we're running today around a modified serious illness conversation guide training to support us as healthcare professionals working in the COVID-19 response. What we're wanting to cover in today's session is to give you an introduction to the Serious Illness Conversation Guide, to let you have a chance to see that guide in action in our current COVID environment, discuss the components that make up the Serious Illness Conversation Guide, and then think about when we're having these conversations with patients or whānau that have a COVID diagnosis, how that process might look and how the guide might support that work. And then finally, we're going to wrap up and give you a link to some of the additional resources that are being created across the country to help support these conversations and discussions going forward. So we know when it comes to conversations and communication with our patients and whānau that it can be challenging. If it was easy, we'd all be amazing at it, there'd be no issues. But the reality are, it is a challenging thing to do at times. And I think a lot of us would recognise the fact that where we are up to now in our professional capacity is that some of the time we're doing some of the right things for some of our patients with serious illness. And I guess where we'd like to get to is the thought that as individuals and as a workforce, we're doing all of the right things all of the time for all of our patients with serious illness. And this is particularly important for us to be thinking about as we move into the reality of what COVID might look like in terms of our workplaces and our workforce. This is an opportunity for us to be patient-centred, not just pandemic-centred. The information that we're pulling together for you here in the New Zealand or Aotearoa context comes from a lot of work that's been done out of the United States with Ariadne Labs. Their mission is to improve the lives of all people with serious illness by increasing meaningful conversations with their clinicians about their values and priorities. For brevity today, we're not going to go through the research in a lot of detail, but suffice to say we know from the research that early conversations about patient values and goals are linked to better serious illness care. We also know though that in reality, conversations are often infrequent, late, or very limited. And that if we do have the conversations, we're often not very good at documenting what we've heard or what the patients have told us, which makes it difficult for other people to continue those conversations going forward in the future or to access that information if we're needing it to help support clinical decision making. So why do we use checklists or guides to help support these conversations? There's a huge amount of evidence that suggests complex tasks are sometimes difficult for us to remember all the intricate details. And what checklists do is they help us bridge the gap between the evidence and the real world implementation. Checklists help ensure that we tick off all the bits we need to as part of that process. The other great thing about a checklist is they help support us to achieve a higher level of baseline performance. And we know that when we're having these complex conversations with patients and whānau, our level of anxiety is high, their level of anxiety is high, and it's really useful to have a framework to come back to keep us on track and to give us those words when we're stumbling to think about how we say the next thing we need to. Now, there is a lot of evidence that is starting to amass around the use of the guide in the Serious Illness Conversation Guide. A lot of it comes out of the States because that's where it started, but increasingly we're starting to see evidence from other countries. For the purposes again of today, I'm not going to go into that in a huge amount of detail, but suffice to say that the main finding across multiple studies is that serious illness conversation guides support efficient conversations that elicit patient preferences. Essentially, it's fast and it works. On average, we see these conversations taking between 8 and 14 minutes. The first demonstration we're going to show you today is a conversation between a palliative care physician and a patient using Aotearoa Serious Illness Conversation Guide. So this is the guide that we've created and that we've been using across the country for the last 18 months. We're having this discussion with someone with a serious illness in the context of COVID, in terms of that's sort of what's foremost in the patient's mind in terms of the conversation. And our chance today is to see how Lynn, our clinician, navigates that discussion. So a bit of background. Our patient today is David. He's in his mid-40s. He has metastatic bowel cancer. It was initially resected and he underwent some palliative chemotherapy. And after a few rough months with some recurrent bowel obstructions, his symptoms have been improving and he's actually got to a point where he's back managing a little bit of part-time work from home. Lynn is his hospice doctor who's having this discussion with him today. She's been working alongside the oncology team to support his symptoms and his management. And she's catching up with him today to have the serious illness conversation, her goal being to understand his priorities and wishes if he was to deteriorate due to his cancer. But equally, she's also aware that he is at higher risk if he was to encounter the COVID virus.
Hi, David. Thanks for meeting with me today. I know it feels a bit different not to be meeting face to face, but it's great to see you anyway.
Yeah, hi Lynn, it's good to see you too.
Great. And I know with you working in IT, you're probably really comfortable with meeting with video conferencing, but I know sometimes things can come up with the video or with the audio. So if you have any problems along the way, just sing out and we'll try and fix that. Does that sound okay?
Yep, no, you sound loud and clear, Lynn.
Awesome. So we want to be sure that you have the best possible care. And to do that, it'd be really good to talk about what's happening with your health at the moment, what might be ahead, and what things are important to you. Does that sound okay?
Yeah, is this because you're worried I might get COVID?
David, COVID's on everybody's mind at the moment, and it can feel really scary, especially when you already have, a serious health problem like you do. But actually, it's not the reason that I'm wanting to talk to you today. This conversation is one that I try to have with all of my patients because it really helps me to understand what's most important to you. And now more than ever, it feels like that's a really useful discussion for us to have.
Yeah, okay, I guess that'll be okay. Because I guess, I know if I did catch COVID, things wouldn't be looking very good for me.
Yeah,
So,
I can hear.
yeah.
I can hear you. You're worried about that. Yeah.
Mm.
And it is an important conversation. Would you like someone else to be on the call with you? We could organise that with a video chat if you'd like.
No, it's just me and my bubble. I'm talking on the phone with my kids pretty much every day. Mabel drops off my shopping regularly, but other than that, I don't really have anybody else. So I'm happy to talk on my own. Yeah.
Okay. Yeah, I'm really glad that you're still keeping up with your kids. I know how important they are to you, David. Yeah. And with this conversation, there's a number of things that I want to check in with you about. Would it be okay if I use a guide just to make sure that I don't leave anything out?
Yeah, sure, not a problem.
Oh,
yeah.
That's great. Thank you. So just to make sure that we're on the same page, can you tell me about your understanding of what's happening with your health at the moment?
Well, at the moment, I'm not feeling too bad right now. It's been a rough few months, as you know. With all those times I've been into hospital when my bowels blocked up. I don't want to go through any more of that again. But I feel like I've finally gotten back into some normality. And, I've been able to even catch up on some work my bosses sent me a while back now. And the syringe drive has been great. It's been keeping me out of hospital. I realise that now. I think I'm finally getting used to it. Yeah. And I had my scan a few weeks ago. I don't know if you know the results, but I spoke to my oncologist about it last week, and he said things aren't looking good, and that things are growing. So I know the future's not going to be particularly good, but at least things are okay right now, and so I'm just focused on trying to keep it that way for as long as possible.
Yeah. And I'm really pleased to hear, David, that you're feeling a bit better at the moment. Sounds like you've had a lot to think about. In terms of your health, how much information about what might be ahead would you like from me?
Oh, look, Lynn, I really want to know everything you can tell me, absolutely, yeah.
Sure.
So any information would be good, yeah.
Sure, yeah. So this is my understanding of where things are at. I have had a look at your scan results, and you're right, it does look like the cancer is growing, and you've had these bowel obstructions coming and going, and you're needing to have the syringe driver really constantly to keep that at bay. It can be really difficult to predict what will happen with your health in the future, and I'm hoping, like you, that you'll continue to live well for a long time. But it is possible that you could become unwell quickly, and I think it's important that we prepare for that possibility.
What you mean, like if I get COVID? Because truth be told, that's what I've really been worried about lately. What might happen if that's the case.
And I can hear that COVID's really on your mind, really worrying you at the moment, and it is something that we need to consider. But I'm also concerned that your bowel cancer might bowel cancer might mean that you could become unwell quickly, even without COVID. You could develop another bowel obstruction that's not responding to treatment, and that could be life-threatening.
Really? You think I could get sick that quickly again?
That's what I'm concerned about, David. I know that's a really hard thing to hear.
Yeah. Well, it's a bit of a shock hearing it, but I guess, truth be told, I've always sort of like had that at the back of my mind. I was just hoping to just keep ticking along for a while now that I've, finally pulled through those hospital admissions. Just the thought of having to go through that all over again, and that it might even just be around the corner, it's really gut wrenching.
It's a really hard thing to think about. I know. Yeah. Can I ask you, David, about what your priorities are if your health does get worse?
Oh yeah, I guess, my main priority is my family. I want to spend as much time as I can with them, even if it's just a phone call or Skyping or Zooming, it means the world to me to hear them every day, and I look forward to it. So it's pretty much all I have. I've only got them in my life at the moment, so they're really important.
They're absolutely critical, yeah. And what worries you when you think about your health changing?
Oh, that's a tough one. I'm really worried about getting sick again, really worried about somebody sending me back into hospital. From everything I've read, hospital's not the place I want to be right now. Really scared about catching COVID, because I know if I did, then I probably wouldn't survive it. Nobody would be there for me. I'd be all alone, and that scares the heck out of me.
Yeah, I can hear that that's a real worry playing on your mind at the moment, David. And I think we can make a plan to try and address that worry of yours. Would it be okay if we talk about that in a little while? Because one of the things that I'm really curious about at the moment is what's helping you through the tough times.
Well, I guess, just getting back to that pile of work that's been building up and chipping away at it, that helps to normalise and distract me, I guess. And, I'm currently working on a health IT project, so, that really adds extra impetus, because I know, how important that is. So doing my bit, I know really, counts both for me as well as others. Yeah, but it's hard, it's hard being in lockdown. So yeah, it's been important staying connected with my friends and checking in on them, because I know that they haven't had it easy neither. So yeah, so that's important as well. Yeah.
Yeah, sounds like those things are really meaningful for you at the moment. Yeah, yeah. Can I ask you what abilities are so important for you that you can't imagine living without them?
Gosh, all right. Well, just being well enough so that I can actually have a normal conversation on Zoom, with my kids. That's something that I don't think I'd be able to live without.
Yeah.
And I guess being in isolation, the bottom line really is, being able to take care of myself day in, day out. I found it, it's been tough, but God, how I just can't imagine somebody else needing to do those sort of things for me. So that's going to be hard.
Thanks for telling me about that. Yeah, it helps to know. If your health does get worse, how much are you willing to go through for the possibility of more time?
Well, look, I've been in hospital in the past, and I feel like I've really gotten a handle on the syringe driver now. It's been great, I've never thought, but it's been actually, really great. So I really don't think returning to hospital can do anything over and above that, especially with the whole COVID thing. I've got my home well set up. My groceries are delivered, my medication's all delivered. My GP's just at the end of the phone. Hospice nurse calls it every day. So I really don't think I need to go into hospital. If it is possible to that it can be avoided.
Yeah, and we can talk about that, David. And I just have been really impressed by how well you've been managing, your situation, in the circumstances. That's been really impressive.
Yeah.
How much do your family know about what's important to you?
Well, Susan knows everything, and I speak to her on a daily basis, and I think she keeps the kids in the loop as best she can. So yeah, I've really come to rely on her a lot, much more than I would have ever thought. So she's been really good.
Yeah. David, I've heard you say just how critically important it is for you to be connected with your family, and also how it's helping to be as normal as possible for as long as possible. That's really important. And I'm really hearing that you're worried about going to hospital and the risk that might pose to you of getting COVID or being separated from this connection with your family that you're managing at the moment. So keeping that in mind, I really want to reassure you that I think that we can make a plan where we keep you at home, and that we can manage your symptoms at home just as well as they would be managed in hospital.
Yeah, that sounds really good.
Yeah, I think
like
that's really important focus for us. And I think to make sure that everybody who's caring for you is on the same page about that, it would be a really good idea to set up another conversation, maybe with your GP, and I'm happy to be part of that conversation with you, and anyone else that you think might be helpful to involve. How does that plan sound to you?
Yeah, no, that sounds really good. I think I'll ask Susan to join in as well. She really needs to hear this. If for nothing else, then for the sake of our kids, more than anything else.
Yeah, you read my mind, David. I think that it's very important that Susan knows what's important to you at the moment as well. Yeah. And I'm going to do all that I can to make sure that you get the best possible care. Just before we set up that meeting in the future, is there anything that you'd like to go over again or ask me about?
No, I think that pretty much covers everything. Look, and thanks for listening. It's been great. I really appreciate this opportunity. You know, it's actually really put my mind at ease a lot. So yeah, it's been good.
Oh, it's been my pleasure, David, and I want to thank you for being so open with me and letting me know how you feel about these things. It's been great to talk.
Yeah, it has been. Thanks, Lynn.
So that demonstration we've just seen, Lynn having a conversation with David, gives us a good example of the guide in action and also how you might navigate and respond to some of those patient concerns about COVID in the current context that we're working in. So let's spend a little bit of time looking at the guide in more detail. The Serious Illness Conversation Guide was developed through a robust systematic process. There was feedback from patients, from whānau, from clinicians of all disciplines and specialties. And what you'll see when you look at the guide is there's sort of a conversation flow down the left-hand side. And on the right-hand side, you can see the patient-tested language that we use to navigate the conversation. The particular version we're looking at on the screen today is the version that was created here in Aotearoa, and it was customised to make it feel more New Zealand applicable with input from consumers and healthcare professionals from across the country. We know that when we face stressful situations like the serious illness conversation, it helps to have language to turn to in order to make sure that we cover the key questions that also allows us to address the important issues in a patient-centred and efficient way. While the ultimate guide is long-term, potentially that you might adapt some of these questions to your own personal style, we do know that the language in the guide works well for patients, they respond well for it, and it gets us the information we need as we navigate the discussion. So let's look at the guide itself. It is a conversation with an agenda, and there are 6 main sections that it covers. The first is the setup. This is an opportunity for us to introduce the idea of the guide. Now this happens after we've done the conversation setup. So there's the setup of the serious illness conversation discussion. Prior to that, there's the setup with the patient or the whānau we're having the discussion with. And you would see with the example with Lynn and David, that was the discussion about IT in the context of how we might be doing it today. It might also involve conversations with some of our clients and patients, mihi and whakawhanaungatanga, to be helping to create that connection as we navigate that discussion. The setup helps us to build trust with our patients, and it gives them a sense of being in control. It begins gently without scaring them too much. We introduce the idea, we ask permission, and we introduce the benefits of the conversation and the reason we're having this discussion today. In the example we saw with David and Lynn, this was an opportunity for Lynn also to acknowledge David's concerns about COVID and why she was keen to have the discussion she was with him today. It's really important that if all possible, this conversation doesn't happen completely out of the blue, that there is some opportunity for us to give the patient the heads up or introduce the idea so we're not blindsiding them. It's also great if there's an opportunity for them to have support people with them. I know that's a little bit more challenging in the current environment, but you would see that Lynn did offer to say, could we bring someone else into this conversation via Zoom to help support that discussion if it felt important for David. So in terms of the assess, this is our chance to understand what the patient understands about their illness. And it helps us get a sense of how much information we need to give them when we deliver the prognosis. We know that if there's a big discrepancy between what the patient understands and what our medical judgment is, that these are the patients that have particularly poor outcomes at the end of life. The information we're giving needs to be tailored in a way that feels okay for that person, and this helps us navigate that. So it's important that we check in with them to see how much information they want from us. This helps us tailor our gentleness, it helps us titrate it, and provide extra emotional support if we need to for that patient. I guess when it comes to the next step in the guide, which is delivering the prognosis, as many clinicians, our initial thought of prognosis is often time-based. And while that is one way we can deliver prognosis, the guide gives us other options as well. One is around an uncertain diagnosis, when we're not quite sure what might happen for that person in the long term, that we hope they may continue to be well, but we're concerned that things might change for them, and it's an opportunity to prepare for that. The other option for prognosis that the guide gives us is that of function. This can be particularly useful. I've had experiences with patients where, although they were very aware of the time frame that they were working within, they hadn't really anticipated that their health would change over that period of time. They sort of assumed that that sort of 6-month time frame they'd been given, they'd continue as well as they are now and then drop off quickly, rather than recognizing their function may decline. So this can be a really useful prognosis to use when you're wanting people to recognize that this might be as well as they are now. We know from a multidisciplinary approach that the function prognosis is also something that often our nursing and allied health staff feel more useful and comfortable using in that context. After we've given the prognosis, it's really important to take a breath. The breath is 2 reasons. One, it provides that patient an opportunity to process, to have some space, to feel the emotion of the news we've given them. The breath also helps us as clinicians to pause, to think where we're up to and recognise the impact of what we might have said for that patient or the whānau that might be in the mix with them. After we've taken the breath, we want to start understanding and exploring what's happening for them, eliciting their priorities, their worries, and the things that give them strength. We then move on to exploring their critical abilities, how much they're willing to go through for the opportunity for more time, and how much their whānau are aware of what's happening for them and where their thinking is up to. Now you'll see when you look at this explore section, the conversation has an ebb and flow to it. We give them prognostic information, we deal with the emotion, and then we talk about the things that are important to them to kind of raise them up. Then their worries are the things that might be more uncomfortable or sad for them. Then we move back to strengths, again, a more positive focused approach. This helps us navigate that discussion for them. Then we move into the recommendation section. Now this is something that I think is incredibly powerful as part of this process of the guide. The recommendation is our chance as clinicians to take everything we've heard about what's important for them and package it in a way that they can hear that we've heard them, and then we give a clinical recommendation based on that information. Now that recommendation brings into fore our knowledge of what's available and appropriate for them given their condition, and in the current context that we're going to be working in with potentially maybe less resources available, it also means that we can pitch that at the level that we know is useful and appropriate for what's happening in the current environment. The final part of this discussion is affirming commitment, telling that person that we're going to do all we can to support this process. That doesn't mean personally we will be there every step of the way, but it's an important step for patients to hear that we're there. And then we just check in to make sure that there are no further questions that they have and who else we need to be supporting with that conversation. So the key points of this process: listen more than you talk, give a direct, honest prognosis if it's desired by the patient, allow silence, and respond to emotion. You will have seen from the demonstration of the conversation between Lynn and David using Aotearoa Serious Illness Conversation Guide, the complexities that the COVID environment brings into the mix. People are still getting sick with their serious illnesses, but they've got an increased anxiety that sits around what might be happening and what the impact might be. We're hearing from clinicians things like people are really anxious and they're choosing to defer their scheduled treatments. Another clinician told us that people are saying they don't want to come to hospital, even if they really need to, because they're so scared it's full of COVID. And a registrar recently said to us that people are still sick with normal illnesses, they're still dying, and the visiting restrictions mean that they're dying alone. Communicating to whānau that their loved one has died over the phone is really, really hard. Given this context that we're currently working in, we've done some work around adapting the Aotearoa Serious Illness Conversation Guide to create a COVID version. And there's actually two COVID versions that sit in the mix. One is to help us have conversations with patients about their COVID diagnosis and what that might mean for them. And the second is to support those conversations, often over the phone, with whānau members. When we look at the COVID-specific Serious Illness Conversation Guide, we see that there is more detail added down the left-hand side of each section. This is to help support us with our thinking. It helps remind us to introduce ourselves and acknowledge the situation, to check the patient's understanding and seek permission, to share the information in the current crisis, to pause, to explore what's important for the patient, and to close the conversation. In the right-hand side, in the patient-tested language portion of the guide, the COVID version acknowledges the situation that we're in. It acknowledges that this is difficult, and it gives us an opportunity to invite other people to support the discussion. When we move on to giving prognostic statements, this section has been adapted to relate to specifically to the COVID-19 situations. You'll see when you look at this section that we have divided the prognostic statements into if recovery is hopeful, if recovery is uncertain, or if death is likely and imminent. This gives us an opportunity to deliver that prognostic statement depending on where we think things might be heading for that person. As with any prognostic statement giving, it's really important that we pause and allow silence and respond to the emotion with empathy that is going to come up. Some of these prognoses are particularly challenging for people to hear, and it's really important that we give them space to be acknowledged and to receive empathy. The Explore section of the COVID-specific Serious Illness Conversation Guide has been shortened. It has initially 2 key questions, asking what the patient's priorities are if their health does get worse, despite everything we are doing, and what worries them most right now, or when they think about their health changing. These are probably the most important questions to be asking if we're in a situation where we are either time-poor clinicians needing to get information quickly, or if we have patients that are really unwell that don't have the ability to have long conversations with us, particularly if they're short of breath or struggling with hypoxia. If we have more space and capacity, it would be great to ask some more questions. What might be important for them? What might help them in this situation? And it may also be useful if you're needing to make some clinical judgments about quality of life down the track, to spend some time unpacking what abilities are so important for that person that they can't imagine living without them, or if their health was to get worse, how much they were willing to go through for the possibility of more time. This might help support some of our decisions about escalation of care. The final section of the COVID-specific Serious Illness Conversation Guide is our clinical recommendation section. This gives us 4 suggested options for recommendation and aligns with the national goals of care categories on the goals of care documentation. The first is thinking that we'd do everything we can to support that person to pull through the infection. The second is similar, but with a limitation potentially on escalation of resuscitation. C is looking at focusing on improving symptoms and well-being. And D is about focusing on comfort and supporting them to die comfortably if that is where we think the trajectory is heading. And then to pull that back together at the end, we still need to check in with the patient, how that plan seems to them, affirm our commitment to give them the best care we can, letting them know that we're there to answer any questions that they may have, and reiterating or checking in to see if there's anybody else we need to contact and support as part of this conversation. COVID means we're navigating an environment where patients have increased anxiety and emotion, where clinicians have increased emotion and worries about how things might be playing out. These challenges are complex and they bring an added layer to the work that we're doing. Using the COVID Serious Illness Conversation Guide helps us and supports us as we transverse these more difficult conversations. So the discussion we're going to see now is between Vic and Carla. Vic is in her 50s. She's living at home with her teenage daughter and her niece. Vic has rheumatoid arthritis and has been taking methotrexate for the last year, meaning she's now at higher risk because she's immunocompromised. A couple of days ago, Vic returned a positive COVID test and her condition at home has been deteriorating. Carla's a nurse practitioner and as part of her local DHB's COVID response team, has been asked to contact Vic and assess and triage what's important as the next steps for Vic's care. So that's what we're going to see today, a conversation where Carla is talking to Vic about her diagnosis and what this might mean for her going forward.
Okay. Hi, Vic.
Hi.
My name's Carla. Thank you for meeting with me on video. It's a bit different than meeting in person, but thank you.
No, thank you.
How
Thank
are
you
you
so
feeling?
much.
How are you feeling?
Oh, I'm so worried. I'm so worried because I'm just not getting better. Yeah.
Yeah.
Actually quite anxious, I think. Yeah.
The nurse told me this morning, which is why I think it's good to have a conversation. So I'm really sorry that we're in this situation.
Yeah.
And that you're feeling so unwell. We do want to make sure that we have the best care possible at this difficult time. To do this, it would be really good to talk about what's happening with your health at the moment and what might be ahead and what things are most important to you. Is that
okay? Yeah.
Okay.
Yeah.
This is an important conversation. Is there someone else that we should contact to join us?
No, I don't want to. I can't bother. I live, I'm at home and I'm with Maggie. She's 16. She's my daughter. I'm a solo mum. And then my nieces come to stay. So I don't want to bother them. No, I'd just rather just chat to you myself. Yeah.
Okay.
It's okay.
All
yeah.
right. Thank you. So to make sure that we're on the same page, can you tell me your understanding of where things are at? What's happening?
Okay. Yeah. So, well, so a couple of weeks ago, my niece came from New York to stay with us. She's in our bubble. And she's been well. She hasn't been tested for this corona thing, but she's been quite well. But about 5 days ago, I started to get quite short of breath. And I've got a cough, a little bit of a cough. I'm sorry if I cough during this. I might cough a little bit.
Okay.
But that's probably okay. It's just that I've got rheumatoid, and it's not good having rheumatoid, but worse than that, I'm on a metha something drug, I don't know, but yeah, methotrexate, and it lowers my immunity, and I know that because my rheumatologist said that I can't fight off diseases as well. So I think I'm getting sick. And then I've got this immuno thing happening in the background, and so I think I won't fight it off as well, and I'm just worried that I'm getting worse. I know I'm getting worse, and I'm really scared.
Yeah, that must be so scary, knowing what's happening with other people with this illness. Yeah. Okay. Thank you for sharing that understanding with me. It's good to know.
Yeah.
Can I share with you my understanding of where things are at?
Sure.
So Yeah, you are right. From what the nurse told me, you are worse than you were yesterday, and there is a chance that that things will continue to get worse. As that's what you're worrying about, understandably. So I hope that this isn't the case, but I am concerned that you might not recover, even if we do give you everything that we can in terms of treatment. I'm not saying that's definitely the case, but it's a possibility, and that's what I'm concerned about.
Yeah, I am too. I am too. What about my daughter?
Sounds like your daughter's on top of your mind at the moment.
Yeah.
Yeah. Okay.
I don't want to go to hospital.
Okay.
I don't want to go to hospital because people, you can't have visitors, and some people aren't coming out of hospital. I mean, it's just so scary.
It is very scary. It's a scary situation to be in.
Yeah.
Vic, what are your priorities if your health does get worse?
Well, I want to get better. I have to get better.
Okay.
I absolutely have to get better. So I'm going to fight this.
Okay.
I'm quite strong. I've got to get better for my daughter. And so I guess if I have to go to hospital, I'll go to hospital. But if it really wasn't winning, you know, if it's because of the rheumatoid and stuff, then I'd want to come home actually, if it got to that. But my priority was really staying well or getting better. Yeah.
Okay. All right. That's good to know that. What worries you most? You talk about your daughter. Are there other things that worry you?
Well, yeah, because well, if something did happen to me, what would happen to my daughter? And oh, I don't really even want to consider this, but I'm just scared that her father will find out, because if her father finds out, he'll just take charge and he'll come and get her and he'll just make the whole thing so much more dramatic. And I just don't want that to happen. But he kind of has a right to know. So that's probably what's worrying me the most.
Okay. Knowing that your daughter's father needs to know, but you don't really want him to get too involved.
Yeah.
Okay.
Yeah,
Thank you.
I know what that'll be like. Yeah. But yeah.
All right. So, Vic, what I've heard you say is that your daughter, obviously your daughter's at the top of also you're worried about her father getting too involved, but also aware that he does need to know. And I also hear you saying that really your priority is to get better, that you really want to fight this and recover.
Yeah, I'm going to do that. Yeah.
Okay. All right. So keeping that in mind, I'm wondering, first of all, a couple of things. I'm wondering that whether we do everything we can. I suggest that we do everything we can to support you to pull through this infection. Okay.
Yeah. Thank you.
Including going to hospital, because I think that's going to give you the best chance to get through this. Okay.
Yeah. Yeah, but
if it becomes clear that you might die despite everything we're doing, we will do everything that we can to keep you comfortable. And I hear you say that you'd want to be brought home in those circumstances.
Yeah, I think so.
Certainly take that into account when we're looking after you.
Yeah.
Okay. There's a
horrible thought though.
Depend on that, but yeah, we don't want to think that that's going to happen, but I think it's important to plan for just in case.
Okay.
Even though we're going to focus on getting you better, it's good to have a plan B just in case. Yeah. Okay. The other thing that I suggest that we maybe I can support you to have a conversation with your ex-husband.
Yeah.
Because I think your sense is that he does need to know.
Yeah.
And this is part of the plan B, I guess, as well. So maybe I can help with that.
Okay, I think I probably need some help and support for that. I just don't feel strong enough to do that at the moment. Yeah.
Sure.
Okay.
Okay. We can talk a little bit more about how that might work, how I might be able to help you with that. Okay.
Okay.
Let's focus on getting you to hospital, I think, and getting you on the road to recovery if we can.
Okay.
All right.
Thank you.
Okay. So how does that plan seem to you?
Well, I don't want to go, but I want to get better. So it's just one of those situations. And I think probably I need some help to talk to Maggie too. Yeah.
Okay.
I don't want to frighten her, so maybe you could talk to her too.
Okay.
Yeah.
Maybe I can do what I need to do, and we can have I can have another phone call with her.
Yeah.
Yeah.
Okay. Yeah. No, I think that's a good idea. Thank you.
Okay. All right. So I will do all that I can to help you get the best care possible. Okay. Is there anything else that you'd like to ask or go over?
No, not at the moment. My brain's just like so full, but
Of course
I don't know. Thank you.
All right. One step at a time, hey?
Yeah.
Okay. All right. I'll get back in touch with you shortly once we've organised some to get you to hospital. All right.
Okay. Thank you.
Okay.
Okay, I'll talk soon.
Thanks, Vic.
Okay.
Yeah, we'll talk soon.
Bye.
Bye-bye.
Wow, that's a pretty tough watch. It's tough as a human watching that, and I think it's even more challenging as a clinician watching that, thinking they might be the conversations that we're needing to navigate and support in the coming weeks and months. The other thing that's really important as we watch that demonstration is that Carla was faced with some tough questions from Vic. She didn't always have the answers, but she acknowledged, she held, and she gave her the opportunity to come back to those parts of the discussion further down the track. And she also continually came back to the guide to support her in that conversation when things were getting difficult. So in both the conversations we've seen demonstrated today, the clinician and the patient arrived at a shared goal of care at the end of the discussion. For Vic, that was a restorative approach, that she wanted everything done, all active treatment offered, which is why the decision was made to escalate her to hospital. For David, his goal of care was primarily about improving his quality of life. One of the benefits of a shared goal of care discussion is it provides both the patient and the clinician with an agreed direction of care. It may be that the specifics of the treatment that may or may not be offered came up during that discussion, or the specifics need to be agreed or decided as things change for the patient, as their condition deteriorates, or in a follow-up discussion. In terms of documentation, the National Shared Goal of Care document has recently been released and is available to access on the Talking COVID website. A number of our country's DHBs are looking to move towards this documentation. Others may have existing documentation that they've been using and will continue to use during the COVID crisis. The messaging is write it down. If you've had these conversations, please make sure you document it so people can have an appreciation of what was discussed, what the decisions were, and what's important for that patient. So the key thing to remember when you're having a serious illness conversation guide discussion is that these conversations mightn't be easy, but they are important. Stick to the guide, say the words, acknowledge the emotion, agree a plan, and write it down. So we're hoping that opportunity today to see some of this work has given you a chance to think about how the serious illness conversation guides might support you in your communication with patients and whānau. And we're thinking about where to next. Well, I guess one of the first ports of call for you might be the Health Quality and Safety Commission's Talking COVID website. That has access to all the guides that we've seen today in action, the Aotearoa Serious Illness Conversation Guide, the COVID Serious Illness Conversation Guide, and the COVID whānau Discussion Serious Illness Conversation Guide. We haven't seen that in action, but that's a guide that supports the discussions, as I said earlier, with whānau potentially over the phone or via Zoom. If you have an opportunity to be practicing some of these discussions with the people you work with, find a buddy, go through the discussion, get your tongue around the words before you might need to use it in clinical practice. I'd highly encourage that if it's possible. I'd also encourage you to do a little bit of thinking about how these conversations and the documentation of these conversations might fit into your local context in terms of your local resources and documentation. There might be places on your electronic medical record where they could be captured or potentially highlighted in your notes or other aspects of your clinical record. Think about where it might be, and if it's possible to have some consistency within your organisation, that would be all the better. If patients are asking you about how they might capture more about what's important for them, encourage them to visit the Advanced Care Planning website. There's a whole lot of resources on there for patients and whānau. There's also resources in the current COVID context to support their thinking in that space. And as a clinician, if you've got some thinking about what's important for you going forward in terms of your health, you might consider visiting that site as well and thinking about your own advanced care plan or these conversations with the people you love that are at home in your bubble. Thank you all so much for your time today. We really appreciate you joining us. We know how precious everybody's time is at the moment, so we want to thank you. We hope that what we've pulled together today will be useful as we navigate these conversations in the days and weeks ahead of us. And I'd like to close with this karakia. E rangi, e papa, e te whānau atu. Whakatohe atoa, koutou manakatanga. Ki rotu, e tēnei mahi o mātua. Sky Father and Earth Mother and the family of gods, infuse your blessings upon this work. Kia hamaru, kia kaha, stay safe, stay strong. Thank you.
Peter, is it?
Yes.
Hi, my name's Tammy and I'm one of the intensive care outreach doctors on call tonight.
Okay.
And we've been called down to see Evelyn, whose condition has taken a little bit of a turn for the worst.
Yes, that is my understanding. I got a phone call, so yeah.
Yeah, okay. We want to make sure that Evelyn has the best possible care, and to do that we probably need to have a discussion about what's going on at the moment and kind of what might be lying ahead for us, and importantly what's important to Evelyn. Is that okay?
Yep, that's fine.
Okay. This is kind of an important conversation, so I'm just going to use this checklist, if that's okay, just to make sure we cover off all of the important areas.
Yep, that's fine.
Okay.
Yep.
Is there anybody else who needs to be with us for this conversation?
No, just me. That's absolutely fine. Yep.
Okay. Just to make sure we're on the same page, can you just tell me what your understanding is about what's going on with Evelyn at the moment?
Well, she's had ovarian cancer for a year and a half or so, but in the last 2 weeks she was admitted to hospital because she had an obstruction in her bowel,
Yeah.
And so they've operated.
Yeah.
But post to that, she's had some complications, some infection at the wound and urinary thing that's cropped up. So it's been a bit rough the last couple of weeks.
Okay. And in terms of her overall health, how much information would you like me to give you?
Oh, everything. Yep.
Okay.
Yes.
Okay. Well, this is my understanding of where we're at right now.
Right.
Evelyn has, as you know, quite advanced end stage ovarian cancer with multiple organs involved. Over the past 24 hours, I think she's taken a turn for the worse, and it looks to me like she might have a pneumonia on top of everything else that's been going on.
Right.
Her blood pressure's quite low, and it is, I think she's in a critical condition.
Right. Okay.
It's difficult sometimes to predict, but I'm certainly concerned that things aren't going well at the moment. And I'm concerned that Evelyn's time might be short, sort of in terms of days now.
Right. So, what do you need from me?
Okay. Did Evelyn ever talk about what her priorities were if her health worsened?
Well, I mean, the immediate priority for us was to, get her back home from this operation and to sort of come back from the cancer to a certain extent. So that was sort of our goal. I guess I'm a bit unsure now as to what our goals are.
Okay. Did she talk about what worried her, what her worries were if her health changed?
Yeah. I mean, she has talked to me in the last little while that she's sort of fed up with being in hospital.
Yeah.
That she's had a lot of care at home prior to this, and she's a very strong-willed and self-contained person, and she hasn't liked the invasion of her personal life in terms of toileting and showering and so forth. And so the idea of any kind of care and sort of rest home care is something that she doesn't want.
Right,
if that makes sense.
Yeah, no, that makes complete sense to me.
Yeah.
And what helped her through tough times? What did she draw upon?
Well, I mean, we've been married since early 20s, so we have been, lifelong partners, really. So, and it's been a privilege for me to be there for her because she's been so great. So I guess our relationship is very strong, and we have a couple of great kids, although they're currently in the UK, and they were coming back in the next few weeks. But they're but you're saying time could be short.
I'm worried that time is short.
Mm-hmm. Okay.
Okay, so children, right? We do need to think about that.
Yeah.
We'll come back to that in a minute, if that's okay. What abilities were so critical for her that she really couldn't manage without them?
I think, it's that, I guess it's that sort of self-care stuff. She finds that very difficult, that she can't do those things for herself.
Yeah.
And I think that, that really irks her.
Yeah, okay.
So that's probably the big one.
And how much do you think she would be willing to go through in order to get a bit more time?
You see, I mean, this is, I think that she sort of said she's had enough. At the same time, I sort of want to, make sure that we give her the best possibility for help as well, in terms of her condition. But I want to honour her her desire not to be sort of overly interfered with, really.
Yes, okay. Okay. From this, I'm hearing that Evelyn wouldn't want us to do too much in terms of intervention, but I'm also hearing that she might want to see her children and bring them back from overseas.
Yes.
Okay. And keeping those two things in mind, I suggest that maybe we give Evelyn some antibiotics and maybe give her some fluids to help with possibly some dehydration that's related to bowel obstruction, and some antibiotics to try and treat the chest infection. And I think it's time to talk to your children to see if they want to or are able to come back to New Zealand to be with Evelyn. But I think we should focus on those things that are important to Evelyn right now, and that's keeping her comfortable.
Yes. Yes, I mean, that is my concern, is that I wanted to see her now, to see how she is, if she's in any pain, or I mean, obviously she's must be having difficulty breathing, is she, if she's got this blooming infection in her chest?
Yeah, she has got difficulty breathing, and I think we should treat that with medications that would relieve those symptoms, and physically supporting her breathing with machines or tight-fitting masks, I think would only prolong her discomfort.
Right.
And it's a real balance between maybe giving Evelyn a little bit more time so she can see her family, but also respecting what she would think was the right thing to do for her.
Yeah, I think that's about right, actually.
So you think this plan is okay?
I do. I think you're right with the emphasis on comfort, and trying to just give her a bit more time, because I know the kids, as soon as they hear this, they'll want to get home as soon as possible.
Yeah. Okay. And I think we're all on the same page, and we all want to give Evelyn the best care possible.
Yes.
So thank you for this. Is there anything else you'd like me to go over, or something you'd like to ask me?
No, I think that's all. I'd just like to go and see her now, and just like to thank you for your wise words.
Okay. We'll be keeping Evelyn on the ward.
Yep.
And I'm not on tomorrow, but I'll hand over to the on-call team, and I'll get them to make sure that they touch base with you tomorrow and see how things are going. Is that okay?
That would be great.
Okay, thank you.